is lead surgeon of Department of Plastic and Reconstructive Surgery in Achyar Sushruta Hospital, Bangalore, India. Just shortly about his education and early career, he graduated with Bachelor of Medicine and Bachelor of Surgery in 1999. Worked 3 years as intensive care unit surgery, trauma, dermatology, public health services. Completed postgraduate training at Amrita Hospital and earned supermicrosurgery specialization in plastic surgery in 2010. Also, shortly about his professional experience, he spent over 10 years in Narayana Hospital, Bangalore, progressed there from lecturer to head of department. He specialized in hand and neck reconstruction and performed numerous local and free flaps. He also have a national record from flaps, 300 flaps per year, and also he usually presents at national conference and publishes multiple scientific papers. Dr. Sachin would also share with us his book, Clinical Discussion in Plastic Surgery, and I'm very happy to greet you today and to meet the surgeons that have such a great experience. To tell shortly about his training and innovations, he innovated microsurgery training in his hospital and started training at animal models in his institution. Over past 5 years, completed 3 training visits to Japan, trained under Professor Isao Koshima, and also, as I understood correctly, he's a creator and CEO of Crazy Group, which we will be introduced in the.
So once again, welcome all of you. And I have a disclaimer before I proceed. This presentation is the journey into super microsurgery world. Hope it benefits my audience, at least partly. And all images have been subjected to copyright. And I have taken permission from the patients as well as the surgeons, which I am borrowing the images. So my quest to understand reconstruction started way back when I started to do my general surgery, and I cannot but forget my professors, especially you R. Nandakumar, who guided me to do this specialty, learn the specialty in its earnest way. Professor Subramaniam Iyer was my guide and my HOD, my mentor, and he also has been pioneer in many surgeries, and especially he is leading surgeon in highest surgery of hand transplants. He has done almost 37 hand transplants, which is the most number in all over the world. I cannot forget my mentors in general surgery, Professor C. Gopalakrishnan, who was fondly called as a parathyroid surgeon and endocrine surgeons. So almost I used to assist him every week, 6 to 7 parathyroid cases, which is a huge number. And Professor S. Vaidyanathan, who really handheld me in the initial steps of surgery. So with that, I started my practice almost 10 years in a very institute base where I dealt with all types of surgeries like cosmetic, then, small accidents, major accidents. And I learned all the nuances of flaps and reconstruction. Especially in India, we have a lot of burns patients, so the contracture release. And my real specialty or my passion was always head and neck reconstructions. But whenever I did such surgeries like microtia, any surgery which involves three-dimensional framework, I had few questions in the mind. I could not make the 3 dimension well, and the results were very suboptimal. So my search for the masters began, after my 10 years of practice in institution. I first visited Japan 2018. So this talk is not just the journey, but how I failed or how I overcome the failures and finally set up an institute. So it will be divided into 3 visits to Japan and what I took back. So the first visit was in 2018, and it was one of the pioneers. If you all know about Nagata, Professor Nagata is known for his single stage or two-stage beautiful ear reconstruction. I was there for 3 weeks and I only observed. I could not get hands-on. So when I came back, I was unable to perform even a single surgery. And that's why I call it unsuccessful. The things which I learned is I didn't have the instruments. I was searching for the ideal patients because Nagata operates at the age of 9 and second stage at the age of 10. And in India, in my part, most of the patients come after 20, 21, just before getting married. So my first uh, journey, the first step was not successful. It was a failure. But we always take it in a positive way. Whenever there is a failure, it is the first step to success. So that was why next step, which was a visit to Takumi, I planned it well. I planned by reading all the articles, almost 400 odd articles of Takumi and Koshima together. I performed few LVA surgeries in my institute, and whatever I could understand, I formulated a plan and went for almost 1 month, 35 days in 2023. With me, there were 5 more observers, and they were from Korea, UK, Turkey, Spain, Armenia. And I always had few questions in my mind to all of those observers. How would you implement what you are learning? How would you take back to your country? Do you have the same setup or almost similar kind of environment to operate such cases? And should we collaborate? These 3 questions are always asked to them, but hardly all of them or only few people are interested. And I am still in contact with Armenia, one person from Armenia and one from Spain. So when I came back, the challenge in my institute was to explain them that I required so many instruments like the microscope, the ICG machine, the dye, and the most costliest instrument as the microscope. Like Zeiss microscope, which we procured, was, you can see in, I have written in the Ukrainian uh, nomination, it was almost 7 lakh, 71 lakh Ukrainian amount. The ICG machine was very costly again, and the USG machine was too costly, which you could not buy. And the set for microsurgery, again, it is super microsurgery. It is almost around 4 lakh Ukrainian dollars. So this was the microscope first I had to get in the institute. And I had second challenge. How do I explain my oncosurgery colleague that you give me cases? Because most of the oncosurgery colleague used to say, we don't have any complications like lymphedema. In fact, they said we don't have any patients after breast cancers which lead to lymphedema. Then this colleague of mine, she agreed to give me some cases. And the first case I did after returning from Japan, from Takumi, was after almost 3 months. And we did this case where I did multiple LVAs and I added liposuction as well as excision. So this is the result of my very first case. And this helped in fueling the positiveness and fueling my initiation of lymphedema into my colleagues. And slowly I got many lymphedema cases. Here it is a congenital primary lymphedema, genital lymphedema, and you can see the results after surgery. Then I formulated a plan. These were the number of cases I got in the next few months, mostly breast cancer, even including one male breast cancer, and mostly very few of stage 1 and stage 2. The rest all is stage 4. I hope you also will be seeing many of the stage 4, not like what I saw in Japan, where there is stage 1 and stage 2, very, very common. I had to get the ICG machine, but this machine was a not the original. It is a cheaper one, but it works the same. It gives me the same images as a PED Neo can give you. How it is come. And I started making these reports of my own compared to the ICG International Dermal Backflow Staging. This is also helpful for advertisement. When you give this report to patients, they themselves show it to many doctors. And because lymphedema is a very slow growing, lymphedema awareness is not there among doctors as well. This helps in understanding what lymphedema means. And anyone who wants to start lymphedema, they should and must have this ICG machine, which is very helpful to get attention of the patient, because patient doesn't understand what is lymphedema or what is this dermal backflow. But once they see on the screen and the reports, they are actually satisfied. This was my initial few patients. As I learned from Takumi to measure it before and after, this is, I started doing something called as prophylactic lymphedema care. So where I started operating with the oncosurgeons, as here you can see, these are normal pathway just done after axillary clearance or even on the time of the surgery. So what is the concept of prophylactic breast lymphedema surgery is, before, as we know, when we do the axillary surgery clearance, there is going to be lymphedema. If you do level 1, 2, 3 axillary clearance, there is chance of lymphedema, maybe 50 to 80% in the literature. So why don't we do lymphovenous bypass, one above the elbow, one below the elbow, or even possibly in the axilla. But in the axilla, lot of lymphatics are destroyed because of cauterization by the oncosurgeon. And you have to wait till they complete the surgery. So what I try to do is, the same sitting, this is my oncosurgeon colleague, she's operating on the breast. I come from the opposite side. I alone sit with my instruments and I start doing LVA surgery simultaneously. So we did many such surgeries. You can see the ICG marking in patients with normal but dilated lymphatics. So I try to mark this before surgery, and one above I select and one below the elbow, because we have to drain forearm as well as the arm. And this is how the markings, the measure, the ICG, and the places hardly 1 centimeter of incision. And this flow pattern is equal to what I have learned from Swami, the Japanese surgeon, surgeon who is working in Australia, and he has mentioned 100% of the flow is on the medial aspect. So I make the LVAs in this aspect. So advantages of doing such surgery is early treatment and no requirement of extra anesthesia. And very importantly, when you start lymphedema, you have to do some number of cases. So it can be a potential to improve your own skills. There is no harm, because we don't actually charge the patient extra, same anesthesia, and there is no harm except 2 small incision of 1 centimeter each. So I started doing this, convincing. So when I sent this to Takumi, Dr. Reiko visited India. She visited to see what I am doing, how I am performing this. And she stayed with us for almost 18 days. So she also suggested many things how to do. And we had our first Indo-Japanese conference. It was done in 2024. And I'm planning to do the second Indo-Japanese conference in 2025 in October. And you're all welcome. In fact, you can be speakers in that conference. We had a number of delegates all over from country, as well as online Dr. Koshima. And In this, we had many lectures, special lectures from the Indian surgeons, Japanese surgeons, and my own colleagues. But the most important thing what happened here is uh, I got a connection to directly Koshima from Dr. Reiko. So as you see, my second visit was not a complete success because I could not convince all the onco surgery colleagues about how should I get more number of cases. It was a partial success, but you see, you can see the glass half empty or half full, and the plastic surgeon is an artist. He uses that half full glass to make his own painting and create his own vision. So my second step to success was the vision, where I went to the master of masters, Professor Isawa Koshima, and Alexander also has already been there. I had done the fellowship for it was 6 months, but because of my work, I could not do it for 6 months. And we used to have daily lymphedema surgery right from the day one because I had the certificate of eligibility. If you ever plan to go there, you have to plan quite before with insurance, medical indemnity insurance. If you do that, you start to operate from the day one with professor. And what to tell about professor? Professor is out of this world in his all aspect, his ethics, his work experience, and his camaraderie. He's He's par excellence. And if you want to learn more about him, this one of the very good article written by doctor from USA. She's in USA now. It mentions everything. Coming to what I learned before I tell you what I did in my country. So I asked him, what is the best instrument to do surgery? And to my surprise, professor said it is chopsticks. And I know you will not believe this, but just yesterday's lecture, he mentioned about it. You please hear it.
Fine, surgeon. So completely same technique as lymphovenous anastomosis. This technique is very important. But anyway, you are Oriental microsurgeon. India also Indonesia. You use a chopstick. Or are you use a chopstick?
Yeah.
No?
We learn.
Huh?
Yeah, we
But
learn.
anyway, Indian microsurgeon have a very fine fingertip technique, completely same as our chopstick technique. So that's why Indian, also Asian microsurgeon has very fine super micro technique anyway. Already we master.
No, it actually means is to use a very small instruments. If you can develop the tactile sensations on your fingertips, which generally happens if you use chopsticks or you use your fingers for eating food, because every day we use our hands at least minimum 3 times to eat food. So he was saying if you can make the neurons, the memory neurons, from the tip of the finger to the brain, you can develop the skills more faster. That's what he meant. So and also supermicro is not just the technique or the instrument or just a name. It is how you develop the skills after doing microsurgery. So if you are doing microsurgery for a few years, you can definitely venture into supermicrosurgery. Just for someone who is listening for the first time, the super microsurgery is something below 50 micron, 3 millimeters. So on the left hand side, you can see a 80 needle, and right hand side, you can see the 10, 11, 12 0 needle. It is such a difference. It's such a small needle. And this is the scale, which is 0.1 millimeter. And before I could even understand supermicro, Sensei, Professor Koshima is already training people on nanomicro, which is 1 millimeter, on nanotubes. But we won't go into that. We stick to our lymphedema. So how do I implement? My first was a failure. Second visit was a partial success. and now the odds were ticking. So how do I implement this practice of Koshima Sensei into my practice? So the new beginning started when I came from his center in 2025 December. My focus only, I converted my all focus into lymphedema. I do surgeries other than lymphedema, but I gave up my very good job in an institute and started my own center with my Ayurvedic colleague. Ayurveda is a branch of Indian traditional medicine. One of my colleagues started a hospital where he wanted an allopathic doctor, surgeon, so I joined him. So this is the hospital, which is a 24-bedded hospital, a small hospital, and on the first floor is lymphedema center, and the other floor is my teacher's center. And two of the professors from Hiroshima both visited here, Dr. Hiro Sensei and Dr. Marozumi Sensei. They visited this institute. I'll talk to it about later. And I named the institute as Koshima International Center for Lymphedema. So this is a very important slide. If one slide today you have to take from here is this slide. Whenever you have an institute practice, it is totally different. And individual practice is different. Because institute, you can buy such costly things. But in individual level, I got a refurbished seconds microscope, which cost me almost 1/10 of the original microscope, and it functions well. I got the ICG, smaller ICG, which cost again 1/15 or 1/12 of the original one. And I got a handheld USG. I think it is available in markets in China, Japan. If you are visiting there, you should just get one handheld ultrasound. It is important. I will tell you in my next slides. And I got Indian set of super micro, which is again 1/10 of the cost. So I reduced the cost from almost a few millions to a few lakhs. So my setup, I will show a small video. Please have a look at it. From the OPD, before the surgery, this is my outpatient department area where patients come and see me, and I'm going to the inpatient area. I make sure my patient understands, and I counsel the bystanders too. I'm trying to explain what I will do in the surgery. खोल के उधर ही ज्वाइन करते हैं, एकदम छोटा है माइक्रोस्कोप में। आपको इसका वीडियो बना के भी दिखाऊंगा। ये तो पूरा समय हमको बात करते करते टीवी पर देखेंगे। Okay. So before the surgery, I see that I explain in details because patient's confidence and trust is very important with the surgeon. And I already showed you the ICG machine. It's a very small device, which is costing, I think, 2.5, 2,50,000 Ukrainian dollars.
Seen how it is come. Okay.
And you can just connect to your laptop or your whatever device you have. But this is what I mentioned, ultrasound. Because I learned from Koshima Sensei, ICG is for the patient's trust or feedback. But for us, ultrasound is very important. As you can see here, the marking of small lymphatics, in which here we can see, this is the superficial fascia. This is the lymphatics, which is both are meeting together. And always it is below the superficial fascia. That is the deep fascia and the muscle. And this is the dermis. So we mark this, and there is a superficial vein also, equal size. So these two we connect. So ultrasound is a very important tool. And just before the surgery, this is my ward where I prepare the patient for surgery. Most of my surgery is done under local anesthesia because getting an anesthetist for long duration surgery in my place is difficult. So when it is LVA, I just inject local, and I do that under 3 to 4 hours, where I give a break to the patient. They go for washroom break or they want to have juice, but it is done under local. As you see here, she has already undergone morning surgery. Now evening again, my one staff and myself, we don't have extra hands because it's all simplistic surgery and patient is very happily watching the screen and we are talking to the patient, so it helps in doing long hours of surgery. This is how I do. If there is a surgery where I have to take lymph node transfer, either from supraclavicular or the axilla, I do it under anesthesia, either evening or the next day. Now, small innovations, because smaller steps will make a bigger leap. So I did this small fish hook, which is very important part for retracting the 1 centimeter incision, which is $10 in Japan, which is only $0.1 by our make. And how do we do? Whenever we have free time, I involve my colleagues, my staff, because when they interact with us like this, it's very good to know. In the lengthy surgeries, they are more motivated. So this is how we do small inventions. There are many inventions I have done, or not invention, but discoveries, I can say, in many ways, which I will share. Now, very important thing is always take care of your instruments, especially the super micro instruments. They're costly. One single drop, it will destroy the instrument. So here, my co-worker, he is doing his work is to clean instrument, but I am not giving him my micro instrument. Micro instruments I take care because he's doing his different. Micro instruments collect like this. It is gone. So there is no shame, no harm in cleaning your instrument and keeping it separately. This is my team. I mentioned Dr. Ramesh Bhatt. He is an Ayurvedic surgeon, and myself and my other staff. So we have a good team in our hospital. Now it doesn't stop here. I had a failure in the first, partial success, and I can only say that my third trip to Koshima is a complete success if I start having visiting surgeons from different world. As Dr. Professors came to visit, also Reiko came to my place. So we had a CME because they are not plastic surgeon. We had a CME in orthopedics. Even they operated on our cases. They got permission to operate, and I plan to have a fulfilling success when I get more and more people. They come and train themselves and they visit our country. They do the surgeries when they go back to their places. So we have started this crazy group. Crazy stands for creative, reconstructive, aesthetic, zealous, and youthful by heart. Such surgeons, we have started this group, and every week we have, like you have this Sunday, we have Saturdays. We are having with Koshima Sensei as our main leader, and under his guidance, one new speaker from different part of the world, as you can see from Spain, Pakistan, and we had Alexander as our speaker. So I invite you to join this group and be part of a larger plastic surgery community where we exchange ideas. And slowly we have developed different centers by Koshima's name, Professor Koshima in Bangalore, Coimbatore, Mumbai, Peking. And these are the centers all over the world, Japan and India. And I'm very sure in the sooner region, it will be also in Ukraine, somewhere here. With Alexander and Melinik, they will take over. So take home from today is failure is always a step towards success. Super microsurgery is the wave in the future, and we need more and more lymphatic surgeons because lymphedema is going to grow, not the infection lymphedema like filariasis, but after oncosurgery. Oncosurgery related lymphedema is just growing in numbers, and super micro will always help in enhancing your microsurgery skills. I wish all of you, my Ukrainian friends, peace and prosperity. And from bottom of my heart, I thank you for your kind attention. Thank you very much.
Thank you for your great speech and for such a mind-blowing examples, and for that super microsurgery under local anesthesia that divided for two episodes. Like, dear guests, perhaps we have a question. You can prepare them.
Can you have a question in the chat?
Dmitry Sergeyevich.
Yes. Thank you so much for this wonderful presentation and your huge experience in organizing and doing lymphatic surgery. I have maybe a few questions. First is more technical question is in case of prophylactic lymphatic surgery, yes, so-called lymph. Where do you prefer to do LVA? In the axillary wound during axillary dissection, or you prefer to do it on the arm?
Yeah. So when I started doing it, I started doing in the axilla. But when I want to see the lymphatics, it is all charred because of the cauterization. Everything is all very badly charred. My oncosurgery colleagues, they do it in 15 minutes. So I stopped doing there. Then I asked Professor Koshima Sensei. He said, you do just one above the elbow and one below the elbow, which will drain entire upper limb. So I started doing then one each above and below the elbow. But I initially started to doing the axilla, but it was not good at all. The lymphatics were very bad. Especially the lymphatics were burnt and the veins were also not, they were very huge veins. We want smaller veins. And there is a group in UK. They are doing it. The oncosurgeons themselves are doing it. They have published in journal of I think in the oncosurgery journal, but which is not correct. They just whatever globe of lymphatics they feel, they anastomose to the vein. That's not the right way of doing it. That is my opinion.
No, it's good when you're doing axillary lymph node clearance and LVA by yourself, you know. No,
Yeah.
I have few cases of prophylactic lymphatic surgery, and when I'm doing axillary lymph node clearance, you'll find these small lymphatic vessels. Put the clip on it, yeah, to enlarge the lymphatic vessels, and in the case if you are not doing the axillary lymph node clearance, yes, it can be a little bit challenging to find them and to preserve. Yes, thank you. And another question is, what is your algorithm when a patient comes to you after, for example,